we get an option to record this just in case if
I
anybody.
do. I'm recording, so don't worry.
Beautiful, beautiful.
All right,
It
floor
didn't
is
give me
yours,
that choice
guys.
here. All right, Shubham. So let's introduce you. Let's tell all of our audience who Shubham is. Let's start with
Yeah,
that.
sure. So, hey guys, I'm Shubham. I'm currently a third year resident at Mercy Catholic Medical Center. As you all might know, I'm going for the ASH Hematology Focused Training Program at University of Minnesota. I'm someone who's outgoing. I love improv comedy. I love biking a lot, and I also really enjoy blood and its diseases. So here we are.
Awesome. I'm Omol. So I will be hosting this, and any questions anybody has, you can just drop those in the chat box. And while Shubham is talking, we will keep adding those questions so we get our answers. This is our chance. So Heme is very special to Shubham. That's why he picked that track. It's a very unique track. So anybody who's not aware, like we have different options in hematology oncology. We don't have to just go for heme or just, I mean, not for the combined one. We can pick one instead of both and focus on that. And I had an earlier conversation with Shubham where he was talking about like why he got into heme rather than hematology oncology and what his vision is going forward and all of that good stuff. Shubham, so tell me, like, how did you get into this? Like, I mean, you did your med school. Did you have any idea this is where you will be heading? No idea.
Not
Where did it
really.
start?
I think for me, the as most IMGs or a lot of people who go through this program or this track
Mhm.
understand is I did do a lot of rotations in US academic institutions. And there I was really fascinated by tumor boards initially. So that's where my original love for hemonc as a specialty started because I loved cross collaborating it.
Mhm.
Then during intern year, we see a lot of patients. I had a patient who had brain cancer and then he comes in with a PE. And so the conversation about anticoagulation in a patient who has cancer and how do you navigate that entire space, because he also had a brain met. So if you anticoagulate someone who has a brain met who comes in with a PE, you have a very high risk of causing fatal intracranial hemorrhage. And I'm like, this is really a very tight space, you know? So I think those questions really fascinated me. And then I started reaching out. I had an inclination that this is what I want to do. I'm someone who is really interested in why is this thing working like this, right? And so the coagulation cascade really fascinated me. It has always fascinated me, even when I was like early in biology classes and stuff. So I think for me, I did have an inclination towards it, but how do you channel that motivation that you have and give it a lot more structure and form? That's where I really liked it. And so then I got on med Twitter and I started looking up what are the things that people do, what kind of research is coming out and things of that
Mhm.
sort. From then on, I found that hemonc is what I want to do. I started reaching out to people, I started networking, and in that space I somehow found the right mentorships. A lot of my mentors were classical hematologists, so I was a little biased in that regard. So that's probably where my interest came through. Why did I choose to go through the ASH fellowship track specifically? Was a lot more focused on what it is that I wanted out of my fellowship program, right? I think the first question that anybody needs to ask before they go into a fellowship is what it is that they're doing and why they're doing it. And that question for me was very simple. What is one thing I can do for the rest of my life without getting bored and be a little excited about? And so for that, it was blood clots for me. And for me, it was going and sitting in a lab and like looking into like smears and stuff. And I found that fascinating. And so I think that's why for me it was solidifying. And as I had more experiences during my training program, that's when I realized that no, yes, this is the exact thing that I want to do.
I see. So you did a lot of rotations, you said. Was that like, I mean, did you do your clerkships in US different programs, got exposed there? Was that your first experience, or was it more in after getting into residency, like your intern year? Where
So
did you?
I think it's a lot about how you make your experience work. So the first time that I was really engaging with hematology and oncology was actually when I was doing a rotation in liver transplant surgery. So I was a surgical sub-I
Uh-huh.
in the transplant service, but when they were having conversations about tumor boards. So liver tumor boards and GI tumor boards were a part of it. And that's where the medical oncologists started coming in. That's where I got my first exposure. So I think it's about finding that motivation in whatever you find fascinating,
Yes.
wherever you might be. Medicine is so nuanced and so vast. So you just need to be able to find that one thing which can make it work for you.
Gotcha. All right. In your intern year, how much did you get exposed to hematology oncology? Like, I mean, what did you do which helped you get to this stage?
Sure. So during my intern year, I did a lot of rotations in various specialties. Hemonc, I obviously had an inclination towards hemonc going into my residency. So
Uh-huh.
I prioritized that. A lot of people have it, a lot of people don't. But I definitely knew that I wanted to do something with it. So I started rotating it. Now, mind you, I come from a very small community-based program outside Philly, which is we don't have specialists, we don't have fellows. So hemonc is primarily a consult service, and so you would
Mhm.
see the consults if they're coming from the ED, or you start seeing patients. And so
Sure.
because I already had an inclination towards hemonc, I spent a lot of my time doing rotations. And then again, MedTwitter was a great boon for me as I was looking up what exactly is going on, right? Like everybody could look up to date, but what it is that you're searching for. So I started looking up like what are the Twitter threads, what are the people that I need to follow on Twitter. And as I
Mhm.
started more and more delving into that, I kind of learned how to be more proactive in understanding medical literature. For me, I
Uh-huh.
think understanding my medical literature, I wasn't someone who was trained in a US based environment. So I wasn't practicing evidence based medicine to the degree that we practice here.
Uh-huh.
I think picking up how to interpret scientific literature, and then I specifically focused that in hematology. And then I
Mhm.
looked into, and that's when I found like hematology, as again, as a lot of my hemoncs friends are, a lot of them want to do solid tumors, a lot of them have a disease focus. Like classical hematology has a lot too. You have sickle cell, you have hemostasis thrombosis, you have transfusion, you have coagulation. So there's a lot more that exists in this space, which I don't think a lot of people know about. So
Mhm.
that's when I started realizing that, oh, venous thromboembolism is not just the conversation about anticoagulation and not. What do
Uh-huh.
you anticoagulate with? How do you anticoagulate? And so that kind of led my research interest. And that's when I started really going into the field of it. And then I started looking up people who are doing work in that. So I think navigating your interest and using the resources, be it MedTwitter, be it UpToDate, be it PubMed. Most of the authors on PubMed are now on MedTwitter, and they're always talking. So there's a lot of conversation going on.
Conversations. Uh-huh.
So how do you engage with those conversations? How do you start? First of all, you need to develop a dictionary, right? For a lot of people here, Papa Heme, you might have heard of him, you might know of him. So he talks a lot about like benign heme stuff. He talks a lot about malignant heme stuff. So I think
Uh-huh.
exploring your interest in intern year in the first 6 to 7 months and finding that realm. I think I'm assuming that most people who are here have already some kind of inclination towards hematology oncology. Just work on that interest more, because the way I plan, I'm also very type A, as most of us are. So I planned my entire residency to a T. The minute I knew that I wanted to do hemonc, I took 6 months to get comfortable with the specialty, what it is that I like, what it is that I don't like. And then the next 6 months of intern year, I tried to figure out what projects I want to do, what interests me, what is something that I can do at my level. I think a lot of programs are looking for someone who has an active interest. Once you have identified that interest, what are you doing with that interest, right? So I was interested in venous thromboembolism, and so I reached out to my mentor. I'm like, who's also a classical hematologist. I'm like, hey, this is making sense to me. I think I'm gonna do something here. I'm not someone who's done a lot of lab-based research. I'm not someone who's done a lot of bench research, but I want to look into various methods of anticoagulation. How does that work? And that led to, and then he was already working on a project of something of that sort about and so I was like, why don't I join this? And that's when I did a first systematic review. Again, I was just data pulling. I was trying to write abstracts. And I think I understand that residency is hard, residency is challenging. But if you want to do something, you just have to put in that a little bit of an extra time. Like I would be scrolling my Twitter when I have some free time rounds, or I would be like going through it every now and then. And it's pretty much like Instagram. I mean, if you keep it in healthy
Yeah.
limits, of course.
Absolutely, I totally agree. Like, put that time where you get stuck on Insta. Instead of that, switch it to that Twitter and just get updated with so much information and the people. Who is your favorite? Like on your Twitter, who you have benefited the most from. Like,
I
would you
think
be
it
able
was
to share
Papa
that with us?
Heme. I think it's Papa Heme, Aaron Goodman.
Uh-huh.
He is a phenomenal hematologist. Then I have also been following a lot of community-based providers. So one of them is Oncology Brothers that do a lot of work in the oncology space and in ASCO too. And so the good thing about Metro is also that you get to meet these people in real life when you go to
Yeah.
conferences like ASCO and ASH. And so that's where you actually build up, right? You look into what they've done so far, you see if that's interesting to you or not. And it's like just that explore button that you can find something. And then hopefully some of these academic positions will be at major conferences like ASCO and ASH. And that's a point where you can actually engage with them, connect with them that, hey, this is something that I want. But in order to do that, you need to have put in the groundwork yourself, right? And as I said, that the groundwork starts from recognizing your interest. Once you have an interest, looking up what kind of literature is coming out in that area, in that realm, and then you can start reaching out to some people through Twitter. To a lot of people also reach out, and there are specific networking events. There are certain conferences. One conference for anybody who's interested in classical hematology, which is a great conference to attend to, and it's a smaller conference that calls it Hemostasis and Thrombosis Research Society, HTRS. I think
Stop.
Tulsi posted about that in the group too. So it's held twice a year, and it's a great conference for anybody who has an inclination towards attending this space or just getting to know about this. It's a little bit more peds heavy, but they're actively also trying to recruit them, and that's also where a lot of my inspiration came from. I attended the HTRS last year in March,
Uh-huh.
and I kind of met people there. I met Jacob Kogan, who's a systems-based hematologist. I met Dr. Nathan Connell, who's also another systems-based hematologist. And when you engage with these individuals in those kind of settings, you actually get to find your community. I think what Tulsi has done a great job is to be able to create a community. So just build onto
Absolutely.
that community by connecting with other people and then building on that relationship, be it in an academic setting, be it in a mentorship mentee setting, and then jumping off or taking off the leap that you need to take for your career.
Okay, and that's great. That's great information to have, and who we can follow and learn more from, and stay active too. And what about the conferences? Like in the last 1 year, would you be able to share? Like, I mean, where did you go? And tell us about that.
Absolutely. So I think Tulsi is also doing a great job at it. But like the way I would go about it is I would make a list of the conferences that I wanted to. So for
Uh-huh.
me, as someone who's interested in classical hematology, HTRS was one. That was a big conference that I really wanted to go to.
Uh-huh.
Second one was ASCO, obviously, because I wanted to get a more comprehensive idea of oncology too. ASH, I have not been able to go through thus far, but I'm hoping as a Nash fellow, I'll be attending that for the rest of the 3 years of
Yes, you will.
fellowship. That's a great conference to go to. And the other conference that I went to was International Society on Thrombosis and Hemostasis. It's ISTH, which is again a very niche, very specific conferences for people who are interested in hemostasis and thrombosis. So the way I look at conferences is, first of all, you're a trainee, which is great because there are always all these conferences have trainee workshops, they have trainee, which could be pre-conferences, they have a lot of networking events that you could attend to. Ash, I know for a fact, has a trainee lounge. ASCO, I know for a fact, has a trainee lounge where you can meet other trainees of that sort. The earlier you start, it's better. Just so hopefully, if you are in your intern year, you can always reach out and go to these conferences. I was also a little bit more strategic in that regard. I know residency is busy. I know it's really hard to find coverage. I know it's also expensive. So what I would do is I would plan my vacations around these conferences. Now, this is not ideal. This is kind of towards certain extent of me being a workaholic too. But I would make sure that I'm taking a week or something of that sort in and around the conference. And these conferences are usually in a nice environment, right? Like HUIS, which happens in January, is always held in like a warm place. And so from Philly, it was always nice to take a little bit of an escape. So you go to these conferences and then you can spend some time around so you can get your vacation time. But doing these in those settings is nice because you don't have to look for coverage. You can always engage with the people who are there, and then you can build on those relationships. So HRs did a pre conference workshop, which I again recommend. Everybody can look it up online, and there's a very clear way of how you can apply to it, and what are your interests and stuff. And based on these conferences, once you go there, spend time in the trainee lounges, interact with other people who are already doing them, and tell them that, hey, I'm someone from this particular institution, from this particular area of training, and this is what my current level is. This is my interest. I was wondering if I can talk to you about it for 5 minutes. Now, when you go to these conferences and meet those people, and when you've done that work, you can also add on to it, saying that I know that you've done something of this sort in this realm. And that gives you a very good warm initiation, or that breaks the ice so easily that you can talk to them. Now, whenever you're reaching out to anybody at a conference in a way that you're hoping to kind of become their mentee or to engage with them, you have to be a lot more sincere. It should not be like, oh, I'm looking for advice. No, you have to be very specific in what you ask them and what it is that you require of them. You don't have to be blunt, you don't have to be direct about it right in the get go, but you have to set expectations, right? And the way you lead those conversations is how you set expectations. So I went up to Jacob Kogan, who's a great mentor of mine, and I said that, hey, I'm interested in systems-based hematology. This is something I didn't know what systems-based hematology was, but given my background, I was like, I want to make sure that classical hematology is not just a specialty which is in academic centers.
Mm-hmm.
I want to increase its access. I want to increase the equity. And how do I do that? And he was like, you're talking my language, right? So
That's amazing. Yeah.
that's how you connect to people, right? Once you
Right.
have the bond, you get their email addresses, you create your CV, whatever work you've done. Also, one thing I will say, as one of my mentors who knows me very well, I took almost 4 to 5 months to create my preliminary CV, just because I was worried that I don't have anything on it. And so, like, am I sending a blank CV to people? No, that's fine. You're a trainee. You're not expected to have 500 publications. Nobody's expecting that out of you. But when you
True.
write your CV and formulate it and send it, that shows initiative, that shows action, right?
Totally.
And when you meet those people,
Mm.
you can then follow up with that action, and that is something that they remember, right? So
Mhm.
when it comes time to application, when it comes times to interview, actually they have your back in the way they might not always have worked with you. There are a lot of people that I've worked with and they kind of vouched for me. Some of
Uh-huh.
them wrote a letter of recommendation, but a lot of them who I did not work with, but they were also supportive in the sense that, hey, I know this guy, he's worked in this particular thing, I think we
Mhm.
should talk to him. And that becomes that gives you a huge pull as compared to a lot of other people who might not be in that space, because you've shown initiative, you've shown action, and you've followed up with that action. So when you're talking to them again at another meeting, and again, the communities are very small, everybody knows each other, we're
Uh-huh.
all bumping into each other in the same conferences. A lot of your friends you'll also bump into on the interview trail. I have a lot of my current co-fellows, I've seen them in multiple interview trails too. So I think it's all about creating that community and telling them and showing that initiative and saying that I am a part of this community. This is what
Mhm.
I want to do. And that answer can be open, but it needs to have some kind of background as to why you're doing it.
Mhm. Awesome. And that's great information. Apart from that, so I'm a little surprised you've not been to Ash yet. It was in San Diego in December, right? It was like awesome. Like there were three other residents and one fellow who joined me, and we went there. And I had the privilege of presenting. Like I got accepted for an oral presentation. So I was like, all right,
Oh,
first
great.
hematology oncology conference, and now this is all right. I got totally excited about it. It was on COVID-19, and it was heme. So, thrombosis in that. So I enjoyed it thoroughly. And that was something which was not tapped into. I guess it was an outcome research. So, very specifically, one particular age group and all of it. And I heard that you also like that kind of stuff, which is awesome. And, but next time, hopefully, I will get a chance to meet you there. You should be there at ASH. So we'll see. Soho is another one coming up and ASCO, right? All of these. But yes. So, okay, let me just, sorry about that. Okay. All right, and tell us about what kind of QI projects you did, and how did you get involved and develop that interest while doing your residency? Did you did you do QI more towards like hematology oncology kind of interest, or was it something open and then you kind of picked this interest a little later? How did you go about it?
So I think one thing I'll say that all fellowship programs are looking for is a candidate's ability to start a project,
Uh-huh.
to put in enough work to see that project through towards end, and that end could be submitting an abstract, presenting an abstract, or submitting a manuscript. So I think that's, as far as academia is concerned, the academic trajectory that people look. You have a question, you create a project out of that question, you present that project at a national or international conference, and then you publish that, hopefully in an effort to change the field, right? So what I came from a community-based environment, I saw that there are not a lot of classical hematologists, whereas
Uh-huh.
my mentor was based at an academic institute in Boston, in a very strong, robust city, which was filled of other academic institutes, right? So for me, what was more challenging is that it was so easy for anybody in those kind of environments where there are academic centers to just walk in and have the exposure to an academic person,
Uh-huh.
versus I come from a community-based environment. I don't have that level of academia, but my patients is they don't have that access, but I wanted to create that access for them. So I launched a project about how do we define the educational needs of a community-based hemon career or a community academic hybrid question. Because my first question to my mentor was, you sit in an academic environment, which is great, but what about the patients who don't have the luxury to be surrounded by academia, right? Don't have
Uh-huh.
the luxury to be around. So I conducted a very simple needs assessment survey. I looked at what are the educational needs of what a community-based physician who is practicing hematology oncology would want in their fellowship. So what I did is I created that survey on RedCap. I sent that survey out to community-based hemonc physicians and asked them that what do you want in your fellowship? What do you think would better prepare you for your current role?
Mm-hmm.
My mentors were very helpful and really helped me push this project to completion, and thankful, like I'm grateful that I was able to present it at the national meeting ASCO 2023. So I think you need to find a question, right? And
That's
once you
awesome.
have that
Yeah.
question, you need to be able to see and ask. This is where your mentors come in. This is where they help you refine your ideas. They will help you figure out what will fly, what will not fly, or if
Mm-hmm.
this is an idea. And there was a lot of pushback that I got from a lot of other people too, that this idea is never going to see the light of the day, or you have other projects which you're very excited about, and the data doesn't come out well, or the outcomes are not coming out well. So I think it's about, once you have a project, see it through. It could be a QI based project, it could be case reports, it could be case studies. But what it is that you're learning from that project, use that in creating another project. So the other project that I did was a systematic review. Now I have never done a systematic review before in my life, but the person who was leading it, who
Uh-huh.
was also a co-resident, he had done some. So we figured it out together. We looked up
Beautiful.
what is the methodology of creating systematic review, what is our question, and this is again the mentor who helped us refine the question. So my systematic review was on comparison of DOACs versus low molecular weight heparin for management of venous thromboembolic events in patients with primary metastatic brain cancer. Now this is a very niche cancer associated thrombosis topic, but I was able to find that topic because I met my mentor and he's someone who does cancer associated VTE. So I
Wow.
think when you go to these conferences, you will meet people who are the key opinion leaders, as Tulsi said, in in their own specialty, in their own niche, and they always have some project to work with, right?
Mm-hmm.
So I was able to present that at ISTH as an oral presentation. I was able to present my
Very
uh,
nice.
needs assessment as a poster discussion at ASCO. And I think that also gave me a lot of confidence moving forward in
Uh-huh.
my interview trail, in my engaging with other people, and what to say, what not to say, what is working, what is not working, you know?
Awesome. That is awesome. I mean, you could just go in that direction, work towards it, and open others' eyes too, like shed light on certain things. And as we were talking about this also, like creating that bridge between the community programs and academic programs too, right? The university hospitals. So would you be able to tell us a little bit about that, like how you plan to, you have that vision in you to create that bridge and connect, right? We were talking about like education and would you
So I
be,
think
yeah.
I think a lot of times what I have noticed is, again, this is all coming from my personal experience. And I think one thing that I really utilized or I backed up on was
Uh-huh.
my individual story of what I wanted to do with the field, right? So I came from a community-based environment, but my mentors were in academia. I'd spent enough rotation time in academic environments. And so that's where my thought process was, how do I bring that level of academia to a community-based center? Now, I know for a fact that I'm not going to be able to create a hemophilia center at my residency program. That's just unreasonable.
Mm.
That's not an expectation that I could have.
Uh-huh.
But how do I start looking and solving simple questions, right? So when I went to for my away rotations at academic centers, I saw that a lot of classical hematologists were kind of saturated. Their clinic panel was saturated with something as simple as iron deficiency anemia. Now, we've all heard it. We all know what iron deficiency anemia is. We all know that you give them iron tablets. If it doesn't work, you give them IV iron. It's literally as simple as that.
So
But when
true.
I came back to my program, I recognized that I, as a resident, didn't feel comfortable catching iron deficiency anemia. I didn't feel comfortable, or I didn't have the
Mm.
knowledge. I would say I didn't. It wasn't a knowledge gap, but it was something that I had never looked into. It was right there in my face. I was seeing as a primary care physician. All of us see so many
It
women
is.
in reproductive age. We see so many older people are who have colon cancer and things of that sort. So something as simple as iron deficiency anemia, I looked into it and I was
Mm-hmm.
like, you know what? I'm going to create a management conference on it. I'm going to read up about it. So I spent some time reading up about it and figuring out what are the different kinds of iron formulations, how does dosing of iron work, what is the current data on it, how is it impacting the over, what is the economic burden of iron deficiency anemia. And that's where you'll get a lot of juice. That's where you'll get a lot of information. And so I created a management conference of iron deficiency anemia for my medical residents. For as a third year, a lot of us have a lot of these academic activities that we need to do, like journal club, management conferences, mortality and morbidity conferences, grand rounds. So use your interest in those areas specifically, because that way what you're doing is you're creating a strong body of work. So when it actually comes the time to interview, you have spent clinical time, research time doing or chasing the aspect that you want. You have also spent, you've shown initiative in academia. A lot of academia is transferring education and advancing the field by teaching others around you how to improve the field forward, right? So I took something as simple as iron deficiency anemia, taught it to my co-resident, taught it to like all the APPs and the people who attended the conference. And then just yesterday, when last clinic block when I was in clinic, people were telling me that, oh, hey, I think I remember your talk from iron deficiency anemia. I don't know, I'm not sure about this. And what that made me is like now I'm very comfortable catching up reactive thrombocytosis if
Wow.
the person doesn't have it, and you just go ahead and do it and you try it. And this is the joy of medicine, right? Very simple interventions will have results, which and I didn't there's nothing I didn't do like a phase 3 clinical trial on it. I didn't do like a hardcore bench research, was pipetting in the lab and stuff of that sort.
Uh-huh.
Hematology oncology can be as simple if you are just willing to look for the questions. And also the important thing is to look for things that you can accomplish. It's very important to know what your bandwidth is in residency. It's very important to know what your scope of project is. If I decide as a second year resident or as a first year resident that I'm going to start a clinical trial, that's not going to fly and that's not going to work. So pick
Uh-huh.
up projects which you can do, which pick up projects which you can start, you can finish, and then you can show that on your CV that, hey, this is what I did. Because in interviews, a lot of times they'll ask you as to like, what did you learn from that? Or what is your interest, right? And at that point, again, for everybody who's applying, people are not looking to have the next Nobel laureate sitting across from them. That's not the expectation. The expectation is you just need to know what you like or have an inclination of liking, and what have you done with that liking, and what is your vision of moving forward your liking
Mm-hmm.
as a future professional in that field.
Uh-huh.
So my liking was, I like hemostasis and thrombosis, I like classical hematology. What have I done with both? I worked on a systematic review, and I
Mhm.
presented that at ISTH.
Uh-huh.
My other liking is outcomes based research. So what have I done in outcomes? This is not technically outcomes based, but define or like addressing unmet needs. So what is an unmet need? Working on oncology or hematology workforce in the community. I took both of these projects, very simple projects. One was a
Mm.
systematic review. I used help with a statistician, and the other one was a simple red cap survey. I presented them at conferences, and when it came to the interview time, I was able to tell them that this is what my trajectory is, this is what my interest is, and this is how I think I want to do forward. And I want you to help me figure out my vision moving forward and help me or enable me with the knowledge that I need as a hematologist oncologist. So when I practice in a community based environment or I practice in an academic environment, I know
Mhm.
what I'm supposed to be treating. Does that make
Mhm.
sense?
Oh, yeah, absolutely. Absolutely. So you're connecting the dots basically, and you're finding the right people who could, you know, give you more information about it. And sometimes it's like, it becomes very monotonous too for the practitioners also. They would be doing something very routine because they keep seeing those patients. And then
Mhm.
same management goes on where you don't have a chance to really, from one day to another, to think about something different. So you are bringing in that different angle. I mean, same disease, similar management, all that is going on, but you are giving a different perspective to it basically. And you're also educating not just, I would say, the practitioners, your co-trainees, as well as like the patients benefit out of it, which is awesome, which is awesome, Shubham. That's amazing. Okay. And we had one question asking about, what are the job opportunities after, like, when you pick a very specialized track like that, like hematology, and if somebody is on a J1 visa, like how are the options or waivers, stuff like that? Would you be able to tell us that?
Sure. So again, this is very preliminary from because this is again from what I've heard or what I've noticed. Other people going into, I'm also on J1, so I understand the legalities of what it brings along. The good thing about classical hematology, and I will continue saying this till the day I die, is there are so few of us right now that there's a huge push. Not a lot of people can manage hemophilia. Not a lot of people can manage sickle cell. So there's a huge requirement and a need for
Mhm.
classical hematologists. So when it comes to actually finding waivers, I understand that the huge question is that, oh, I am on J1 or I need to find a waiver position. But the benefit of doing classical hematology better than oncology is that you'll always be able to find a waiver position in academic institutes because these academic institutes need, like there was, I think there was a waiver, a J1 waiver at Brown for just classical hematology. So I think you are very marketable as a classical hematologist
Mhm.
and you can always find a way around it. So
Mhm.
I think it's about how you, again, just like residency, just like fellowship, it's all about how you market yourself. How do you create that environment that I am indispensable for you?
Uh-huh.
And this is the reason why you need to have me, right?
Sure.
A lot of academic centers like University of Utah has a J1 position, and these
Mhm.
again keep fluctuating, right? They can
Uh-huh.
keep changing. I do recommend for people to put in a lot of thought before you go into something as focused as ASH hematology focused track because it's again a very niche track. I will not be seeing any oncology patients. I would not
Mhm.
be board eligible or board certified in oncology at all. But that is something that I am okay with, and that is something that is by my own choice.
Mhm.
So before you go into this track, please review the ASH hematology focused training programs website. Just
Mhm.
review all the centers. And again, the good thing about the ASH program is all these 8 sites have a very specific niche. So University of Minnesota is one of their niche or tracks is lifespan medicine, which talks about transition of sickle cell patients from the pediatric age group to the adult age group and how do we navigate those challenges. University of Washington has a track which talks about
Mhm.
systems-based hematology. A lot of them, like UPMC, has a sickle cell center which focuses a lot about sickle cell. So I think when you apply to these institutions, each institution has a strength and each institution has a very unique thing that they are offering. If that is something that you're interested in, if that is something that you are engaged, like happy to look into, then look up what the work that the institution has done,
Mhm.
and then you can even approach those institutions with that. And during your interviews, ask them that, hey, you said this on your website. This is the track that you've listed out. Tell me a little bit more about that. Because that, again, as I said, shows initiative. That shows like that you are interested in that specialty. And that goes a really long way.
Hmm. Absolutely. And how about like how many programs are out there which are only like heme track, you know?
So there is, I think there's around 13 of eight are the official ASH awarded sites. There's University of Washington, there is University of there's WashU, then there is University of Minnesota, then there is Emory, then there's Dana-Farber, BI, Bethesda Deaconess. So I think there is around just a handful of institutions who do this
Hmm.
track.
Hmm.
But again, as I mentioned, these tracks are very niche. So when you're applying to them too, you should like when you apply in errors, there's a specific like hematology oncology, like the traditional program, or they'll just have a hematology. So it's important to make sure that when you're applying in errors to check those
Hmm.
boxes of which one you're applying to. Again, as I recommend, this is something that I did personally because I wanted to do it. I had an individual personal statement for each institution that I'm applying to of what it is that I like about them. You can't do that for probably 180 programs. I
Hmm.
understand that. But it's important to write something which makes sense to you and which is going to explain why you want to go into that. Because believe it or not, they will bring up your personal statement during your interview. They will talk about if it is something that catches their eye, they will bring it up during your interview and try to get to know you from that perspective too.
That's awesome. And there is another thing, right? Just like a residency, we would be able to present different personal statements to different programs. So you kind of customize it basically towards each program because, as you mentioned, like each program has its own qualities, or right? So good points about them. So you just mentioned those, and you create your story around it, your interests you build, and show it to them. That's awesome. And how competitive is it? Because yes, tell us about that. And how do you get yourself towards that, you know? Like how do you prepare yourself for it?
I think it's competitive enough. I would say overall hematology oncology, the specialty is very competitive, and I think a
Hmm.
lot of people are doing some really impressive work in that specialty. Um, Again, but I also think fellowship is a very individualistic journey that you'll go through. So I think I've done it too. I was on the Excel sheet which comes out after you've applied, and like everybody keeps track of where you're getting interviews from. But I think it's also largely based on luck. What you can control, as I said again, is what is your initiative of it. So when
Huh.
I was applying, my application screamed very clearly that I am someone who's interested in classical hematology. That's what primarily all my research was focused in.
Hmm.
So I think programs do pay attention to that. Again, the good thing about this track is if you apply specifically to that track,
Hmm.
through eras where again you have, so whenever you apply in eras, right, when you click on a program and what you want to apply to, they have multiple individual tracks that you can apply to, and when you apply to those tracks, the program will see you, the program will see that you have applied to them. So it's competitive in the sense where not a lot of people like want to do classical hematology. It's not
Hmm.
something that everybody wants. Again, yes, that's a reality of it. A lot of people consider classical hematology to be the poor cousin. Yes, you'll never make the kind of money as an oncologist will make, but then it also depends on what you're doing it for, right?
Right.
So for me, classical hematology was that golden apple that I wanted, but
Yeah.
not a lot of people else wanted it. But those who did want it had very robust bench research, had done stuff in it, had published and presented. So
Hmm.
I think academia and your academic pursuits are something that they'll look into. So I think that it's important to strengthen those. So find a project, try to present it at HTRS, try to present it at ISTH, try to present it at ASCO. For all the interns, this is again one thing that I do. Please back plan it. I planned, if I'm applying for fellowship in 2023,
Uh-huh.
I had planned for it almost a year ago in advance. I knew what deadlines I wanted to hit. And in order to hit those deadlines, I wanted to give myself a buffer time. So if you are a resident or a first year resident or a second year resident, then look into when those, or someone who is in hospitalist medicine or someone who's practicing, look into what these deadlines are, because that's your way of getting your name out there by going to these conferences.
Mhm.
and meeting those people. And then these are the people who will remember you. One of Dr. Kogan was also present on my interview day, and he knew me from HTRS. He's like, hey, Shubham, I know. So you already have that ice
You have
broken,
it.
right? At
Yeah,
that point, you're not rebuilding a relationship. Sometimes
exactly.
that's feasible. I did not have that at the other programs that I did, but at some programs I did. So I think create a a profile which
Mhm.
represents what you truly want to do, and that is something that they will see. And then it does not matter how competitive or how many people are applying to that fact.
Right.
And then just be honest about it. I
Just
think
be you. Yeah.
yeah, exactly. And people will appreciate that. People will appreciate the sincerity. People will appreciate that honesty.
They will. And as you were mentioning to me earlier too, when we had our discussion, you have a vision. Like life after, picking this training, this very specialized track. How do you see yourself, like, coming out of fellowship? What would your goals would be? What would you be doing, or where do you see yourself?
So this is giving me a lot of PTSD from my interview trail.
Didn't mean to do that at all.
No, I'm joking. I'm joking. I think what I see myself as someone who is a classical hematologist who
Uh-huh.
is trying to increase equity and access to very specialized treatment which are not accessible to a lot of people. You don't pick sickle cell picks you. And if it is picking you, then yes, you are affected by it. So my mission is how can I help my patients who did not pick up the diseases that they have? And how can I make that more accessible to people who might not be living in the most developed environments, who might not be living in the
Right.
most developed parts of the country?
Yeah.
So the way I plan to do it is I plan to extract whatever I can out of my fellowship, and in fellowship find my niche further. Yes, I have a certain inclination towards doing systems based hematology. I have a certain interest in cancer associated thrombosis, but I don't know what my interest is going to take the trajectory in once I finish fellowship. So I think
Right.
I my
People watch.
first goal right now is to first of all clear my boards, then get into fellowship, and
Uh-huh.
then take the time in fellowship to
Mm.
kind of see what it is that I like. But
Mhm.
I want to do it in the realm of classical hematology. I want to be able to practice in an community academic hybrid model where I'm
Uh,
still under the academic umbrella of a stronger academic center, but I'm working in one of those satellite sites, which some people might want to go to, some people might not want to go to.
right.
And so my ultimate dream is that I am able to help residents and primary care physicians
Uh,
figure out iron deficiency anemia so that those people don't get referred to academic centers for the same.
uh-huh.
And the academic centers have more space to treat people with hemophilia, for to treat people with sickle cell disease, to treat people with who need that level of academic
Right.
specialization.
Huh? And the patients who are coming to the community centers, they still get the right treatment, right? Like they're not getting pushed away. You have to go now to the university hospital, figure things out over there. It's kind of, I feel like it's not too fair to them if we can provide that, if we can be that one for, you know. So that'll be
Well said.
amazing. We
I see
have,
a hand from Dharmik. So I think in with the interest of time, we have 15 minutes. So I'm going to open the floor to all
sure.
the guests to ask questions. Dharmik, go ahead.
Hey, thank you so much for giving those insights. Being at community, I'm in the same boat, and like how you presented those idea, what we can do in a limited resources and what data outputs we can, those like really connected with me and which really put me interested. I just had one more question regarding when you were applying. Did you only apply to the classical hematology or you also apply for hematology oncology? I'm asking this question because like I just want to, I like the both as well. I would like to keep the both options open, but if you apply to one specific program and you apply to the both the tracks, like how do they perceive your interest in either classical hematology and both hematology oncology?
So that's a great question. So I was under the same impression too. I wanted to do, I guess my heart was in classical hematology, but I'm still an IMG. I still wanted to make sure that I have the ability to be a hemonc physician. Only then can I practice classical hematology, right? So I did apply very broadly. I applied to a lot of programs, and I applied to those specific 8 institutions too. When I applied to those 8 institutions, I had very separate personal statements for every single one of them. I mean, if you look at my eras, I had 25 personal statements. For one was a general for general hemonc, one was specific for an institution and how you curtail that. The way I made sure, so at these 8 sites, I send them my individualized personal statements for them. So it was, the good thing is there are not a lot of programs out there. So creating 8 personal statements was a little bit of a task, but I was able to do it and make it specific. And I would send them that specific track. And then a lot of times they will let you know of what track you're interviewing for. So University of Minnesota very clearly in their invitation to me had told me that they are interviewing me for the classical hematology track. UPMC had made it very clear in their thing that they are interviewing me for, again, the classical hematology. So the programs are very transparent about what they're interviewing you for, and they have a very clear idea. And the way the interview cycle also works is that when you get the invite, they also try to match you with what you've done. So the people who I was talking to on my interview trail were also people who had done cancer associated thrombosis, who were doing hemostasis thrombosis. So that really does help it. So you should technically apply very broadly, see wherever you can apply. And then, but for these 8 institutes, I would recommend, if you do have an interest in doing that and pursuing that, then send very specific personal statements, show your interest, email the program coordinator or email the PD about this. And it might, again, it might help, it might not help, but it's definitely worth enough to show that initiative while you're applying.
I can offer a different perspective. Shubham, you're so much better candidate than I am. So I applied pretty much very exactly like Shubham with a difference. I had only one personal statement. Okay. And I interviewed at Shubham's program, and I love Shubham's PD. She's a wonderful PD. But I was interviewed by a hematologist um, to gauge my interest in hematology. I don't think they picked up a lot of interest, but they gave me a thoracic oncologist later on to sort of facilitate, that dialogue. And your PD did tell me, hey, let us know if you are interested in pursuing hematology track. So I went and when it comes to ranking, there's a two different ranking option. And I was one of those candidates that did not apply to palliative or another specialty or fellowship as a backup. I put all my eggs into one. But I could see myself, if I fell down and I didn't become a hemonc, can I see myself as a hematologist? So I did rank the program. So I applied pretty much with the same track approach, but however, I said if I were to limit and change, I would be just heme, and then I would probably, there's few handful of programs that are just medical oncology.
Mhm.
So my plan was, hey, I got into the heme part. I will figure out the oncology part later. So I had only one personal statement. So it's a little different for different people, but hey, it works out. So that's just another perspective on 25 personal statement. I don't know how you did it, man. Kudos to you.
It was very painful, but I really wanted it. I was very clear in that. Again, as I said, I think for everybody on this webinar, I think it's important to remember that you are going to be unlike any other candidate because there's only one of you, and you have to kind of like bring into your strength, look into what people are offering you. Yes, listen to all the advice, but you have to do what truly resonates with why you're doing what you're doing. Because I think there was a very interesting question that I got during my interview trail in at the heme focus track as to why are you even trying to do this? You're never gonna make money, right? I think a lot of times you will be given these off-field questions, but I felt very comfortable looking my interviewer in the eye and telling them that, hey, I think I've put in enough homework, and that's why I'm sitting across you, because this is something that I really want to do. And your program likes me enough or likes my interest enough. And that is why we're having this conversation. So I think I've made up my mind it is as to what I want to do. How I want to do it is something that you're going to teach me for the next 3 years, and then we'll work together to make that happen. So I think you need to be authentic to your own self, right? I think please don't forget that. Please, it's important to take advice from people, but in the end, you have to do what the right thing is. And that what feels right to you, right?
There are so many things I feel like in medicine, we are so connected to the patients, right? We have that opportunity. It's an honor basically to be that person for those patients who come to you in the most vulnerable times where you can give them hope and then, hold their hand and say that everything's going to be okay. We may not be able to give cure for each and everything, but still take away that pain. Not just like psychologically, I feel even like, through the medication, which we do our assessments, give the treatment and all of it. But yes, definitely so we play a huge role. And if we have a vision like how you mentioned, and taking that community centers and creating that bridge between the community and the academic centers and helping those underprivileged population, I would say, who are not like, I mean, kind of neglected, so it will be awesome. And we are doing that already, but we will going forward, we could do it in a very specialized way also. So that's kudos to you. Sure, that's amazing. And Tulsi, I definitely wanted to say this in front of everybody, like this home, the group that you have created, the mentorship group, it make us feel at home. So everybody over here is a homie and all are amazing. The mentors who are joining us, you are giving back to all of us, giving us the direction and all. So, which is amazing. You're taking time out of your busy schedules. You are finishing up your residencies too. Excited about fellowship, starting that a new journey. And congratulations to you all who have matched already. And we are getting there too. But home is truly home to us, as Shubham has also mentioned. Yeah, it's
And
amazing.
please feel free to lean back on us, right? As a mentor, I think, and I think Tulsi takes this very seriously. I take this very seriously. If we are putting ourselves in a position of calling your mentors, first of all, we're not creating any hierarchy. We have been through it just by the random fluke that we were in this application cycle a season earlier than you guys. That's the only difference. But when we are becoming your mentors, I think we take ownership of our mentees. So lean into us, ask us questions, ask us things what you're uncomfortable about. Let us know because we are here to help. And we would also want you to learn from our mistakes, right? So do not make the same mistakes that we did and make the system work for you instead of the system working against you.
Awesome.
Absolutely, I agree with it because I just finished pairing up my 100th mentee.
Yeah.
That's 100 hem-oncologist, hopefully, and they've been paired with a mentor, and each mentor has like two people. Like I think probably around 62 fellows, but it's very purpose driven. So it's kind of like an incubator for creating the next set of hem-oncologists. And in your third year, this is the community service I could find. So I hope it works out for all of us that joined today. And we have time for one more question from the guest. If anybody wants to ask, go ahead. Otherwise, yeah. Anyone needs to ask any more question to Shubham?
Yes, I wanted to ask you a question. Thank you for the insights. So I wanted to ask, especially for the project you mentioned you carried out. So I'm in a similar committee setting, but we have an monk program, um, a monk department, not like a fellowship, but pretty kind of an a moderate kind of activity going on there. But so if you want to carry out like maybe something passionate about, maybe in a monk, is there an advice on how to go about that, to kind of do a project for yourself, not really like the department doing a project?
There are multiple projects that you can pursue, right? I would just look into like if you have even 5 patients, what is the majority of those 5 patients? Is it a breast cancer? Like, is your program or the oncology study program, are they breast cancer heavy or the thoracic cancer heavy? Sometimes they might be doing everything, which is what happens at my program. So then I would just ask them as to like, what is one thing that you see which is the most common, and how can I how can I convert that into a question? I think a lot of my questions, a lot of my scientific inquiry came from just being around them, seeing what I was doing. I was just following them up, and then they were getting these referrals for iron deficiency anemia. So I mean, pick something as simple as that. Like, try to do a QI based stuff on what is the patient experience at that cancer hospital, or what, or like, or your hospital, or what kind of consults are they primarily seeing. If they're getting if the hematology oncology group is getting consults, what kind of consults are they seeing? What kind of consults are where there's a lot of education that they need to do, where the a lot of times you'll see primary or medicine teams consulting hematology oncology for a lot of other, for very simple heme questions too. So you can ask them that, hey, what is one question that you often see and I wish you knew that medical residents or attendings knew about? Then pick up that question and then conduct an awareness project. Is like, what is the program's current awareness about it? Like, let's let's see, uh, triple. We can talk about von Willebrand disease. What is the basic workup that people need to send for von Willebrand disease? You can ask this and create like a small Google survey document and then just circulate that survey around it. And then you can do like a pre-assessment. You can then have a noon conference or a management conference about it. Then you can do a post conference survey, and then you can compare, and then you can create a project out of it, that hey, this is what we saw, this was the pre-intervention data, this is the intervention that we did, this is the post-intervention data. So we think that based on this intervention alone, we were able to increase this awareness and stuff of that sort, and then submit it to a project, to a conference, and then hopefully something as simple as that. You have to learn how to simplify things in the most basic ways, and then build up from that. Does that make any sense?
Absolutely. Absolutely. I mean, there's
Yeah,
things in front of
thank you
us.
so much.
Yeah.
Yeah.
Thank you for your question, Stanley. And I have a couple other questions which I got on text messages. One was about, like doing electives and research specifically in heme is good, or is it okay to be doing like a mixed one also? This was a question from one of our
You could do
members.
either. You could do either again, but you need to be able to cultivate a relationship, because I think everybody
Totally.
knows
Yeah.
that a point of doing an away rotation is that you want to get a letter out of it. It's an open secret. Everybody knows it. So you need to see what you're going to the away rotation for. Are you going there for the exposure? Are you going there to get a letter out of them? Are you hoping for them to interview you? Whatever it is your expectation is, and that expectation needs to be communicated in a very professional and a sweet manner. A lot
Mhm.
of times my co-residents, they communicated that expression very clearly. I did that too. I had a pre-interview like pre-rotation meeting with my preceptor and said that, hey, this is what I'm coming here to do, this is the kind of patients that I want to see, this is what I'm looking into. And everybody, you'll notice, is very open to that. People are very open to the idea that, hey, this is something that, oh, you're interested in seeing hemophiliac patients, okay, I'll put you in with someone who's doing just hemophilia. And so I just spent almost 4 weeks doing that particular disease, or that particular disease focus, or stuff of that sort. So that really does help. So when you're trying to go for away rotations, you can do whatever rotation you want. But again, my rotation was primarily focused in benign heme or classical hematology, because that's what I wanted out of it. And
Right.
so if you're applying for these tracks, I don't think there's a way for them to differentiate that.
Mhm.
But your letter writer, when they write your letter, they will mention about that. That's how, again, the programs will see an interest that, oh, he spent a lot of his time doing it under a classical hematologist. This is what the classical hematologist thinks about him, and this is why we should take him. So I think that again is an
Yeah.
initiative based approach.
Totally. Totally. I mean,
All right,
thank.
we have 1 more minute.
Yeah,
Any
and
issue?
one question that was there already in the chat box was about, managing your residency rotation work as well as research and literature. If you could just, I think you mentioned you did, answer this one in some other way already, but still, like, yeah.
I think the only thing about that is you need time is very essential and time is
Yeah.
very valuable, and you need to extract pockets of time from wherever you can. I think
Yeah.
if people who are very well established academics, if people who are going through residency or fellowship are able to extract time, so should you. You just have to find the right spot and where you can do it. I used to, like, sometimes, I'm going to be very honest, sometimes if I'm in noon conference, I'm not finding something which I am intrigued by, I would be on Twitter, I would look it up. If I don't have the time, I would just bookmark it, and then when I get the time, I would open it again. If I do, there are a lot of bookmarks that I still haven't gone through. So I think, yes, it is hard, yes, it is challenging, and yes, going for fellowship adds a whole different level of pressure. But I just think you need to optimize what time you can use. And yes, there will be sacrifices that you'll be making for the journey that you want to take. So you just have to feel comfortable and balance it out. Sometimes when I'm in ICU month, I haven't read a single thing that I should be reading. So it's not always feasible. And we all get it. We've all been there, we've all done that.
Awesome.
So
Beautiful, beautiful. Thank you so much for your time, Shubham, and thank you for giving all these ideas, sharing with us your story, your journey, and really excited for your future journey as well, you and Tulsi also. Thank you, Tulsi, for having us and all the audience, everybody who joined us, took time to be here. We really appreciate you all, and I wish everybody good luck in your